1 minute left.
Yes.
Both of them.
Whether I can donate.
Yeah.
Oh, hi. Where's Jayant?
Now Jayant's video is on, but we can't see Jayant yet.
Jayant नहीं दिख रहा. इधर है.
He must be finishing his dosas.
So it's 7 o'clock. I think
Hi,
we'll call the
Kalpana.
meeting to order.
Yeah, mute everyone.
Yeah, I'll mute everyone. It gives me a great pleasure to welcome you all to the 29th speaker meet of this Vision Year 2021. Today we have amongst us renowned Dr. SHOAIB PADARIA, Director, Department of Vascular Sciences, JASLOK Hospital, and Vice President, International Union of Angiology. A warm welcome to all 20 co-host clubs from Mumbai District 3141, all the members of various other clubs, and also invited guests and members of my own Rotary Club of Bombay Worli. Before Dr. Padaria takes over, let me make some announcements. All questions to be put on the chat, and Rotarian Mehul Jatakia will ask the questions one by one, so there is no confusions. A few club announcements. We have our surgeries under GG Late FT Khorakiwala Little Hands and Feet at SRCC going on a regular basis. We have crossed rupees 1 crore in collections toward district project of oxygen concentrators with the help of Fuel a Dream, a crowdfunding platform. Many clubs have started this platform to accomplish their club projects. We have already started distributing the oxygen concentrators. Further, we are having an ongoing project of giving water and biscuits at BKC Jumbo Center for vaccinations, where people have to wait for 2-3 hours in line for vaccinations. This project, Rotarian Baldev Sharma's initiative, we are jointly doing with Marshall's Foundation and RCB Worli. We are raising funds for this from members too, if they are interested. Further, we have 16 contracts. We have already given 16 concentrators yesterday to various hospitals, namely Dr. Bhatia Hospital in Bhandup, St. Teresa Hospital, newly opened Rotary COVID Care Center in Palghar, Municipal Hospital in Alibag. We are having our last fellowship on June 10th, 2021. This is on Thursday, and we shall be having an entertainment Zoom meeting and request all club members to participate and attend. Groups are formed in to perform songs, skits, and reels. So do join in. Contact myself or Janvi or Sachin for further details. We have our Rotary District Discount program on May 30th, 2021, and request all to register online and to attend the online discount from 9:30 a.m. to 6 p.m. with many celebrities as speakers joining. The cost is only $750. And can we make it 100% members attending this year's discount? It will be a record. We have done it once before in Kiran's year. Now we can do it again.
Speaker has come.
You can hear
Also,
him, no?
congratulations to Rotarian Taizun and Edith Khorakiwala to enter the prestigious AKS Circle Chair. Rotarian Baldev Sharma for selflessly contributing year on year to the Rotary Foundation, Rotarian Sandeep and Devika, Rotarian Jayant and Rotarian Netra, Rotarian Sunil and Saroj Siresrewala to enter the next level of donors in the Rotary Foundation. We have a Sunday meet coffee with doctor, and we have Dr. Milind Navlakhe speaking to us on black fungus after COVID-19, what to do. A very important topic which should not be missed. It's at 8 a.m. Sunday, 23rd May 2021. All please join, and also tell your friends to join. Major projects which we are doing in Worli, Rotary Worli, is Ashiana project, Annapurna project, malnutritions, blood donation camps where we collected 375 bottles during lockdown, cancer chemotherapies, oxygen concentrators to various hospitals, and we have adopted a school in Karjat. Now a new school building to be built to the old school, which will be attached to the old school building with new 4 classrooms, a play gym, and a dining and kitchen area for the school children. So many projects are there over and above that too. Worli is a big family, and our main function is social work to uplift the social strata of the community with the help of food, work, health, education, and training. Today we have many guests on non-Rotarians and its appeal to them to join the Rotary Club to make a difference in someone's life. Over to you, Mehul, for carrying the meeting ahead. Mehul, can you unmute yourself?
Yeah. Thank you, Nimish. Ladies and gentlemen, please check that all of you are on mute because there was some disturbance coming when Nimish was talking. So just reconfirm that all of you are on mute. We are very happy to welcome Dr. SHOAIB PADARIA to our club today. He's a very renowned person and he's going to talk on a subject which concerns a lot of us. So I'd request our project director for urban malnutrition, Dr. Netra Nairi, to formally introduce him. Over to you, Netra. Please unmute yourself.
Thank you very much, Mehul. And it's my privilege to introduce Dr. SHOAIB PADARIA, a senior consultant, vascular specialist, practicing in Mumbai since last 29 years. He's currently the Director of Vascular Sciences at JASLOK Hospital, with which he has been associated for the past 20 years. Having completed his MD in medicine and DM in cardiology from the prestigious KEM Hospital with distinction, he went on to do his specialization in cardiac and vascular interventions from leading institutions in UK and USA. On his return, he established the Peripheral Vascular Interventions Department in JASLOK Hospital in 1991, with focus on diabetic foot and gangrene. In 2003, he performed the first endovenous.
One sec, you're muted. One sec. One sec, Netra. You're muted.
In 2003, he performed the first endovenous laser treatment for varicose veins in the country, and since then has established one of the largest individual single operator series of cases in the world. His current interest is non-surgical treatments of varicose veins, deep vein thrombosis, and peripheral arterial diseases. I must say I have personally known a lot of people who have been successfully treated by Dr. PADARIA. Having achieved a niche for himself in the subject, Dr. SHOAIB has been on the apex positions of various Indian and international venous associations. He is currently the Vice President of the International Union of Angiology and Coordinator of South Asia Chapter. He has been invited to give lectures in over 25 countries and contributed extensively at various international vascular and venous conferences. He is the Associate Editor of the Acta Phlebologica and the Indonesian Journal of Vascular Diseases. It was a privilege for me as a panelist and our Rotary Club of Bombay Burli for being invited to be part as a host of the V-Win Week and the Rotary Social Day that was celebrated last month in the month of April, wherein the Rotarians from all over the world and the experts in this subject gave talks on, of course, venous and lymphatic diseases, and urged us all Rotarians to create awareness on this subject to our fellow Rotarians and the community at large, just as we are doing our stroke awareness. I would like to inform you, Dr. PADARIA, that we have already spoken to the incoming district governor and our incoming club president, and they have shown keen interest on the same. With this, I call upon Dr. PADARIA to tell us more about his expertise and thanking him for accepting our invitation. Over to you, Dr. PADARIA.
Thank you, Netraji. Rotarian Netraji, that was wonderful, though a little long-winded introduction. We're all friends here. No need for formalities. First of all, thank you, the Rotary Club of Worli, for inviting me here as a guest speaker. It's indeed an honor and a privilege. Nimesh, Netra, Mehul, and the entire club members, thank you very much. When I was invited to speak on this subject, I was excited because I believe that this is something which is of great interest uh, to most people, especially those who have passed the age of 50. And yet, unfortunately, the awareness of this subject is not very great. So I thought that let me say a few words on this and maybe incite some awareness and some discussion amongst the members during this talk. So if I may start sharing my screen of my presentation. Is the screen visible?
Yes.
All right. Okay. Just give me a minute. All right. So what I'm going to speak on today is a topic that's varicose veins, all that you wanted to know. Now, we all know that there is something called the cardiovascular system of the body. And the cardiovascular system of the body basically comprises of the arteries, which are blood vessels which take the blood from the heart to the various organs and the tissues and the muscles. And then the veins, which bring this blood back towards the heart once it's used up its oxygen. However, between the arteries and the veins, there are small blood vessels which are called capillaries. And the arteries, the veins, and the capillaries all together contribute to what we call the cardiovascular system of the body. You'll be surprised to know that the length of the blood vessel in an average adult is pretty large. The length of arteries in an individual is about 10,000 kilometers. Veins are again about 10,000 kilometers. And the capillaries are 80,000 kilometers. So about 100,000 kilometers of blood vessel in an average adult. Today, our concentration is going to be on the veins, the blood vessels which bring the blood back towards the heart. And we'll basically talk about the veins of the legs. Now, there are two systems of veins of the legs. The skin veins, which are also called the superficial veins. And some of us who are fair-skinned and have thin skin, you can actually see these veins, or some of these veins, they appear translucent. And these skin veins, they are responsible for taking about 10% of the blood back towards the heart. On the other hand, there's something called deep veins. And these deep veins take back about 90% of the blood back towards the heart. You can't see the deep veins. They're deep in the muscles and the tissues of the legs. When the diseases occur in the superficial system of the skin veins, the most common disease which is seen is called varicose veins. Most common disease which affects the deep veins of the legs is a condition called deep vein thrombosis. And I'm sure you've heard of both these conditions. And today we are basically going to speak on the subject of the skin vein diseases. And the most common of these is varicose veins. So what exactly are these varicose veins? Varicose veins are large, dilated, tortuous veins which are seen in the legs. And in most people, they may be present silently for many, many years. But in some persons, they may be the cause of many problems. So how do these varicose veins actually occur? As I said earlier, there are skin veins, are those which take the blood up towards the heart. And because this blood has to go back upwards against gravity, it has to be pumped up. And this pumping function is accompanied by the calf muscles of the legs. So when your calf muscle contracts, when you walk or you squeeze your calf, the veins get compressed and the blood goes upwards. But in order for this blood to reach towards the heart, there are multiple one-way valves in these veins. And these one-way valves ensure that the blood only goes in an upward direction and doesn't come downwards. Unfortunately, when these valves get damaged, they are weak, then over a period of time, they do get damaged and they start leaking. Now, when you stand or you sit up, blood, instead of going up in these veins, starts coming down. And over a period of time, these veins, because of the increased pressure of the downward flow of blood, will increase in size and they'll become dilated and tortuous. And these dilated, tortuous veins are called varicose veins. So you now understand how varicose veins actually occur. You have to have weak valves. If you have weak valves and they get damaged, then only the blood will come in the wrong direction. Just standing for long periods does not give rise to varicose veins. You have to have weak valves. And when these weak valves give rise to the varicose veins, they can be of different types. For your example, you can see that these veins are small veins, which you see here below the knee, but they may be connected to deeper veins, which are upwards. And here you can see the veins which are large in the thigh and also in the upper leg. How common is varicose veins? A very common condition. You're surprised to know that about 20% of the entire population suffers from varicose veins. 25% of all women and 15% of all men have some form of varicose veins or the other. In India, about 40 million people suffer from venous disease. It's not a small number. And a lot of these patients, especially in our country and because of the tropical climate, have a severe form of varicose veins with skin pigmentation and even wounds which are called venous ulcers. Now, when you talk of varicose veins, this is a condition which will always progress in severity over time. You will understand that you have to stand, you have to sit, gravity will take its toll. So initially the veins which are there, which may be very tiny, you may not be able to see it. Later you will see spider veins, which are tiny telangiectatic veins usually seen in the thighs, usually cosmetic. Then they will become larger veins. And when the vein size becomes more than 3 millimeters, these are called varicose veins. Later on, you'll get swelling around the ankles, which is called in medical terms edema. Then because of the increased pressure of the blood in the veins, a little bit of blood leaks out into the skin and you get skin pigmentation, darkening of the skin around the ankles, a very important sign of varicose veins. Later, the skin becomes dry, you get scratching in that area, and you develop a non-healing wound, which is called a venous ulcer. So this is basically a progressive condition. Important thing to note here is do not neglect skin changes and pigmentation around the ankles. Many a times we say this is venous eczema, we apply various skins and creams, and we never do an underlying test to find out if they are varicose veins. These are the type of veins we should be careful about. See these tiny veins around your ankle or around your just lower part of your leg. This is a serious condition. Don't take it lightly. Who is more likely to get varicose veins? There are various risk factors. One is you could have a genetic predisposition, a family history of varicose veins, long-term use of hormonal drugs such as oral contraceptives. Ladies are known to develop varicose veins more than males. Prolonged sitting, prolonged standing, over a period of time, age, repeated pregnancies, increased weight, and to some extent smoking, all can contribute to development of varicose veins. When I say venous disease is a hereditary disorder, patients often ask me, Doc, my father or my mother has varicose veins. What are the chances that I get varicose veins? So a very interesting study was done which showed that if both your parents have varicose veins, then the 90% chance the child will get a varicose veins. If only one parent has varicose veins, then there's a 50% chance. But if both the parents don't have varicose veins, you still have a 20% chance, 1 in 5 chance of developing varicose veins. Varicose veins are 3 times more common in ladies than in men for various reasons. One of them is hormonal changes, and secondly, repeated pregnancies, which can contribute to varicose veins. The more the pregnancies, the more the chance of developing varicose veins. When we studied about 405 women with varicose veins, we found that 13% of them only had 1 pregnancy. If you had 2 pregnancies, the chance of developing varicose veins was 30%. While if you had 3 pregnancies, 57% of ladies had varicose veins. The more the pregnancies, more the chance of developing varicose veins. Now, when you develop these varicose veins and dilated veins, what are the symptoms? What are the problems that the patients suffer from? First of all, let me tell you that 50% of patients will have no symptoms at all, in spite of very large dilated veins. And they will continue with this until they get a problem, and that's when they come to us. However, the other 50% have various symptoms. They could be aching in the legs, fatigue or heaviness in the legs, a throbbing sensation, a burning or stabbing sensation. This is very common, especially when you have tiny veins in the thighs. You could have night cramps when you go to sleep at night, severe cramps, especially in the calf muscles. You could have ankle swelling, usually after a long drive, towards the end of the day, prolonged standing. You could have itching of the skin around the ankles, a very important sign of varicose veins. Restless leg syndrome. When you sleep at night, you tend to move the leg again and again. In fact, you tend to kick your partner at night. It's called restless legs. One of the commonest conditions is underlying varicose veins, which you can't see from outside. And in some patients, you can also get numbness, loss of sensation around the toes or the ankle areas. If you have very large varicose veins, obviously, it's obvious. There's no need of a diagnosis. But sometimes, as I said, you can't really see the varicose veins from outside. And therefore, what you need to do is a special type of sonography, which is called a Doppler study test. Doppler is available nowadays at every nook or every corner, but it has to be done by a specialist. Because here you're looking at the blood vessels, and a special type of venous Doppler study needs to be done. If you have early varicose veins, then what are the things that you can do to prevent a progression? You can't completely prevent, but at least you try and prevent. Exercise regularly with focus on your legs. Control your weight. Do not cross your legs when sitting. In fact, if you have varicose veins, try to elevate your legs when you're resting. If you have to stand for prolonged periods of time, shift your weight from one leg to the other every few minutes. If you have to sit for long periods of time, nowadays a lot of us are on computers and office jobs, then stand up and move around or take a short walk approximately every 30 minutes or so. So this will help your calf muscle to work and help to pump that accumulated blood in your legs back towards the heart. If you do have varicose veins, when should you actually see a doctor? When do you need treatment? First of all, when you have complaints of aching, pain, or swelling of the legs. When you have very large veins, because remember, when you have very large veins, there is blood which is stagnant there all the time. And this stagnant blood is likely to develop a clot. This clot can break and go to the lungs and cause a massive problem called pulmonary embolism. A lot of people die because of pulmonary embolism. Sometimes they look very ugly. So cosmetic improvement is requested. If you have dark skin around the ankle region, please do not neglect that. It could be due to varicose veins. If you have a wound around the ankle or lower part of the leg, which does not heal within 3 weeks, this is a cause for concern. Either it's a problem with the arteries, which is fresh blood is not reaching, or there's a problem with your veins. You must get investigated. And lastly, when you have a varicose veins which bleeds, this is a very common problem. Bleeding is absolutely painless, can occur at night, can occur during a bath, and patients can lose a lot of blood because of this bleeding. So having diagnosed varicose veins, how do we actually treat varicose veins? You can, of course, modify the risk factors. You can take some medicines. There are some special stockings available. There is surgery, and nowadays the new non-surgical methods of treatment. We'll discuss all of these one by one. Fortunately, when we talk of treatment of venous disease in India, we are in a pathetic situation. 80% of patients in India receive no treatment at all. Stockings are worn by less than 10% of people. Medicines or tablets are taken by about 5%. And actual definitive treatment of varicose veins, less than 1% of patients have achieved this. And why is this? Because first of all, there's lack of awareness, and secondly, underdiagnosis. Not only amongst patients, but amongst our doctors who have not kept up with medical science. So how can we treat varicose veins? First of all, we must undergo some lifestyle modifications. As I said, avoid standing for prolonged periods, avoid exposure to sun, maintain a healthy weight, exercise daily, avoid crossing the legs, avoid wearing very tight clothes, and avoid wearing high heels for prolonged periods. This can cause a strain on the veins of your legs and cause them to leak. What about the various medicines which are available to treat varicose veins? So you can see on this chart here, there are so many medicines here. There are allopathic medicines, homeopathic medicines, Ayurvedic medicines. And why are there so many medicines? Because none of them actually work. The only drug which has been shown to have some sort of effect, partial effect on treatment of varicose veins, is a drug called Dilated. This is made by a French company. It's been there for about 30 years, and to date, no other drug has been as effective as Dilated. Dilated does help in early cases of varicose veins. If you have mild to moderate disease and mild to moderate symptoms, it can decrease leg pain by about 70%. It can decrease the heaviness sensation in the legs by around 50%. And night kind cramps, it's very useful for night cramps in 80% of patients. So Daflon is useful. You can also wear special stockings. Your doctor will prescribe special stockings. It's not the regular off-the-shelf stockings. They are called class 2 compression stockings. They should deliver a pressure of 23 millimeters of mercury to the legs. Now, they can give some symptomatic relief. But remember, they must be worn every day to be effective, and they can only slightly decrease your progression of varicose veins. They do not cure the problem. Unfortunately, in a hot country like ours, it's very difficult to wear stockings. Most of the patients will not wear it for long. And therefore, we must look for some procedure which will give a definitive treatment for this. In the past, we had surgical procedures like ligation of the veins and stripping of the veins. Over the last 20 years, many non-surgical methods have been developed. And today, I must tell you that 98% of treatment of varicose veins in developed countries is done by using these non-surgical methods, which we call thermal methods and non-thermal methods. I'll discuss them in detail. As I said in the past, the treatment was only surgery. Even in our country today, where the newer treatments are not available, surgery is still followed. But surgery has problems. Surgery can leave permanent scars. With anesthesia, we always know that the risk of heart and lung complications. Following surgery, there are problems of wound infection, inflammation, swelling, and redness, because most of these patients are obese or overweight, or they have diabetes or some other issues. And a very common complication of surgery is the damage to nerve fibers which run around the veins. And if you damage a nerve fiber, it's like sciatica. This can lead to pain which can persist for many months or many years. So let us discuss these newer methods of treatment. There are some newer methods of treatment which are called non-thermal methods. These include sclerotherapy, Clarivane, Phlebogrif, and glue. Now here you don't require any anesthesia at all, and these all procedures also don't generate heat. We are going to discuss two of these procedures. One is sclerotherapy, the second one is glue. What is sclerotherapy? Sclerotherapy, when you use a syringe and a tiny needle to inject a chemical solution directly into the vein. And this chemical solution, when it goes into the vein, it damages the vein and permanently closes the leaking vein. This is a very, very effective method of treatment for small veins or medium-sized veins. And the drugs we commonly use are sodium tetranickel sulfate and polydocolone. So as you can see in this picture here, the spider veins or the reticular veins which you see in the thigh can be very effectively closed by sclerotherapy. This is the patient who has spider veins in the lower calf and the lower thigh and the upper calf. As you can see, I'm inserting a very tiny scalp vein or tiny needle into the vein. As I withdraw that, you can see the blood coming out from that needle. We prepare this solution of sclerosant in a special manner, and then we inject this sclerosant, and you will see the veins gradually fill up and they all immediately get obliterated. Once you inject here, then you use cotton gauze and basically help that chemical solution to go into the distal veins, and immediately you will see the difference in the result. See, all those veins have basically disappeared here. So you get an immediate result with sclerotherapy. And this is the type of results you will get. This is the patient who had multiple reticular veins and spider veins in the back part of the leg, in the thighs, posterior thigh. And this is the result at 1 month. You see the veins have all disappeared just by using sclerotherapy. Another method which is finding some application nowadays is something called glue. Glue is a special form of chemical called cyanoacrylate. It's something like Fevicol or araldite. It is injected directly into the vein using a special catheter. And this is basically used for those people who have very large veins which are very deep. It should not be used for veins which are very superficial or close to the skin, because when you inject this glue into the vein becomes a closed tube, a hard tube. If your vein is very close to the skin and you inject glue, you'll be left lifelong with a very cord-like structure close to the skin. So there are specific indications, but a useful technique. And I'll show you how we do a glue technique. Go back to this and show you a small video of how we do glue therapy. So this is a varicose veins again, and we use this special syringe and a special catheter, which is a plastic tube, for inserting the special glue into the vein. What we basically do is we identify the vein using a sonography, and then through a tiny needle, we put this tube into the vein. This goes into the vein where we want, the vein which we want to close. As you can see on top, that's an ultrasound probe here. We identify the area where we want to put the glue. Then we compress the vein. That means we press onto the thigh. The vein gets collapsed a bit. Then we inject a little bit of glue through that special tube. And once that glue is injected, you can see a small amount of glue coming into the vein. And you pull back and you press hard with that ultrasound probe or later with your fingers. And it's like sticking Fevicol onto wood. It causes an immediate occlusion of the vein. And as you're injecting the solution of the glue, you keep on pulling back and the entire vein gets closed. Then there are the other techniques of closure of varicose veins. And these are the ones which are used in more than 90% of patients all over the world. The most common amongst them is laser. Another one is called radio frequency ablation, or RFA. And then other techniques like steam, microwave energy can also be used surprisingly to close varicose veins. And lastly, I'll discuss something called HIFU. Now, endovenous laser throughout the world has the most experience, done by the most number of people. And we were very privileged actually to do the first document case in not only in India, actually in the entire subcontinent, on the 6th of January 2003 at JASLOK. In fact, over a period of time, it became so popular that currently we have treated more than 17,000 cases, not only from India, but from more than 35 countries all over the world. They come to us for treatment. As you can see from this graph, it has become an extremely popular method of treatment. This is only at one of my 5 centers. We do currently about 16 to 1700 cases a year. So it's a large volume of. How is this laser done? We use a small machine which actually generates the laser energy. And this laser energy is delivered through a special fiber, which is a catheter. It's a small wire-like tube. And this heat is generated and delivered to the tip of the catheter. And this tip of the catheter is introduced into the vein that you want to close. This heat damages the inner lining of the vein and permanently closes the leaking vein. Let me show you how we do it. Here is an example of, you can see large number of varicosities or varicose veins just below the knee joint in this patient. The leakage is actually coming from the vein on top, which you can't see, which is deep. What we will do, we'll try and enter in the vein here, introduce the laser fiber into this vein up here, and close off this entire vein. So how is this done? As I said, the entire procedure is done under sonography. So first we do sonography and map out the entire vein. Having mapped the entire vein, then we give a little bit of local anesthesia to the skin. The idea is to numb the skin. So this is what we do, a tiny little bit of injection. Then through the numbed skin, we put a small needle into the vein. And this needle is introduced under ultrasound guidance. As you can see here, that's the black hole-like thing which you see is the vein on ultrasound. And there you can see my needle is inside the vein. I've aspirated blood. Through that, I'll put a small wire into the vein. And through ultrasound, we will see that a small shiny wire is now seen within the vein. Over that, a plastic tube is put, very similar to angiography. And a laser fiber is introduced into the vein. What you can see, that wire is going into the vein. So this is the vein, this is the plastic tube, and that's my wire laser fiber coming inside the vein. Then we will inject a little bit of local anesthesia, which is called perivenous anesthesia, around the vein. Why do we do that? For 2 or 3 reasons. One is when we inject this anesthesia around the vein collapses over the laser fiber. It's direct contact with the laser fiber. Not only that, when we start giving laser energy inside the vein, the heat energy will only be limited to the inside the vein, not outside. Won't damage any structures. Then we start giving laser energy. Soon as we start giving laser energy, the vein immediately collapses and closes, and we keep pulling the laser fiber down, effectively closing off the entire length of vein. So the laser fiber keeps coming down. As it keeps coming down, it closes off the vein. We start from the level of the groin, and bring it down up to the knee joint where we had inserted the file. This entire procedure takes about 15 minutes. End of that, we pull out the entire assembly, and all that we are left behind is a tiny little hole here, like as if you've gone for a blood test. We put a small bandage, make the patient wear a stocking, make the patient walk for about half an hour or so, and patient can go home. That's basically it. And this is the result. These were the veins before, and this is the veins immediately after a day. You can't see anything at all. Little bit of redness, inflammation because of the procedure. This will also disappear within 3 to 4 days. Different types of veins can be treated by the same procedure. You can see large veins in the thigh, and you can see some veins here below the knee joint, and the result is after a few weeks, the vein is fully closed. See the large number of veins in the upper thigh, large number of veins lower down, all the way up to the ankle. We start with the laser from the ankle all the way to the thigh, and afterwards, you see the veins have all disappeared. No cut, no stitch. See these large veins here. If this patient had gone for surgery, can you imagine the scar he would have been left with? And here there is no scar at all. The entire thing was done with a needle puncture. Young man, courier boy actually, with huge varicose veins. He could not drive his cycle because of this problem. The vein which was leaking was right here on top. That's what we closed with laser. The lower part of the vein, we injected that sclerosing glue-like substance, and see the result on table. This patient has not even left the operating table. The veins are totally closed off. Interesting lady, a Gujarati lady who was embarrassed because of these varicose veins. She wanted to play the dandiya, wanted to wear a skirt, but obviously these veins were creating a problem. Here, the vein was leaking right from top here. We did a little bit of laser on top, put a sclerosing solution into the other veins, and see the nice cosmetic results which we have achieved. So these all sorts of varicose veins can be treated with laser therapy. However, another major problem with varicose veins is non-healing wounds or venous ulcers. We have very long-standing varicose veins. Over a period of time, you develop venous ulcers. And how do we treat these venous ulcers? Interesting case. I'm sorry for this visual, but this is really how patients come to us. This is the cook of the biggest industrialist of the country. He developed a non-healing wound which would not heal, and they relieved him from his job. He came to us, we found a large varicose veins just above the ulcer, which was missed by everyone. Simple sonography revealed that. We closed that with laser. This is the result after 1 month. This is the result after 2 months. An ulcer which was not healing for years. He was taken back by that family. They were very nice. This is now 9 years since treatment. It comes to follow up every 6 months. Ulcer is permanently healed. This is a patient who comes to me from Kenya. He is a marathon runner, comes from the Mumbai Marathon. He had this ulcer for many years. Every time he used to run the marathon, develop the ulcer, and then the ulcer would heal with bandaging. But again, when you start his training, the ulcer would come back. We treated this again because this was underlying varicose veins. We treated this with laser, and this was the end result. After this, he has run 4 more marathons. The ulcer has never come back again. So laser is an effective treatment. As I said, there's something else called steam. Steam is another method of giving heat treatment into the veins. And this is popular in some parts of the world like France because it's a cheap procedure. You don't need expensive treatment. But the machine is not easily available. And no major study or trials have been done. So we are a little reluctant to utilize this until we have trials of long-term effects. The future is going to be something called HIFO, high intensity focused ultrasound. The entire treatment will be done only by ultrasound. No needles, no wires, no anesthesia, nothing. This is a special type of ultrasound probe which has been developed only last year. This delivers special ultrasound energy directly into the vein and helps to generate heat within the vein. It's a very advanced technique. Unfortunately, this is a very slow procedure. As I said, this is only introduced last year. It will still take 4 or 5 years for it to be developed, but the future is going to be HIFO for treatment of varicose veins. I told you all the good things about endovenous laser therapy. But what are the problems which can occur? Like any procedure, you can face a problem with infection. Luckily, in our series of 17,000 cases, Overall, we had 11 infections. I don't know what the percentage is, it's 0.00 something. So if you are careful, chance of infection, not that, because reason being, there's no cut, there is no stitch. Of course, some patients will get some pain, but with the newer types of laser therapy and newer techniques, pain is very, very minimal. There is no bleeding which occurs, bruising does not occur. Nerve damage potentially can occur in some patients if you're not careful, if you're not experienced. So you have to be sure who you're going to for treatment. They must have good amount of experience. Redness and swelling can be seen in some patients for a day or two, but it's not very common nowadays. And blood clots we have not seen. So I showed you very many methods of achieving the same result, the closure. Surgery, laser, radiofrequency, sclerotherapy, all of them basically idea is to close the leaking varicose veins. And to tell you the truth, over a period of 2 to 5 years, the end result is all the same. So important thing is use the technique which is available easily, which your doctor has more experience, okay? And leave your doctor to the decision what he wants to do. The idea is you should get better with a permanent therapy. So in conclusion, friends, what I would like to say is that the newer endovenous non-surgical methods of treatment of varicose veins are safe, easy approach to treatment of varicose veins. These procedures require no hospitalization, there are no stitches, no scars. Patients can go home immediately after the procedure. They can just walk up and go home. However, if you're covered by Mediclaim insurance, then you have to stay 24 hours in the hospital. But otherwise, you can just walk home. There's no prolonged recovery time. You can do all your routine activities from the next day itself. And the reported success rates of 90 to 98% today make this the preferred method of treatment of varicose veins. I thank you very much for the attention.
Yeah, Mehul.
Yeah, thank you, doctor, for that wonderful presentation. And I must add something here. You know, we have a lot of speakers in our Rotary, but nobody who speaks as clearly as you. So it's a very rare to get such beautiful delivery and dialogue. So you have many other career options. Keep that in mind. This is a hint I'm giving you. Yeah. And you know, you covered this subject so beautifully and so thoroughly. The only question is, you know, the starting point for all our treatments is always our GP. And I think that the awareness amongst GPs about this subject doesn't seem to be very high on the priority list. So is it that they are not worried about repercussions, or there are no repercussions, or what is the bottom line?
See, the question is this, that this is a very rapidly evolving field. Newer techniques are coming up every single day. And we try our level best to basically educate our family physicians as far as possible. In the last few years, the Indian Medical Association has made it compulsory for the family physicians to undergo continuing medical education programs. So therefore, nowadays, they do tend to attend these programs. But you are absolutely correct when you say that awareness, even amongst our doctors, is very minimal. Forget awareness amongst the lay population. And we first have to educate our doctors, who will then educate their patients. You are absolutely right.
And you know, right now this pandemic has taught us a lot of things, and one of them is that a lot of us are going back to our roots, which is naturopathy, yoga, exercise. So if we go back to that, two questions directly related to that. One is that people are realizing the importance of sitting on the floor, you know, and eating a meal, for example. So people are trying to spend more time on the floor and getting out of the chairs. And the second thing is that you know, you said that you should not be crossing legs. Now, when you sit on the floor, automatically you cross legs. Yeah. So, can you share some insight into what is the difference between what the naturopaths are teaching us and what you are teaching us?
So when I say don't cross your legs, I mean don't sit for prolonged period with your legs crossed. Because when you are basically crossing your legs, your knee joint, which is there, is at an acute angle. And this acute angle basically compresses the veins. So the flow of blood from the lower part of the leg towards the thighs and the heart is impeded. Now, whenever there is stagnant blood, it can clot. Okay, and that's something which we are very worried about, especially if you have already got varicose veins, because these are dilated veins. That is number one. Secondly, in this COVID situation, you all must have heard that there are a lot of clotting instances which occur. The clots occur in the lungs, but apart from the lungs, where do the clots come in the lungs from? They basically come from the legs. So if you have varicose veins or if an underlying arterial problem, you have to be extremely careful. In fact, in those patients of mine who have blockages in the arteries of the legs or who have significant varicose veins, I put them on low level of blood thinners like aspirin or something like Xarelto in order to prevent clot, especially if a patient who's developed COVID. But the first 3 months after COVID are the most dangerous. You can develop clots at that time, not during COVID, but within the 3 months after COVID. So your point is very good.
Yeah. There's somebody needs to mute themselves. There's some disturbance coming, if it's possible. And the next question is, this you keep emphasizing that this is caused by weak valves. So as a advanced precaution, how do we strengthen?
I'm sorry, I didn't get you. You're muted.
You'll unmute yourself.
Okay, sorry. Yeah. So you mentioned that this whole issue is coming out of weak valves, and as a advanced precaution or for younger people, what is the way to actually strengthen valves apart from medication or treatment, which comes later?
I thought I would have a few more years to retire, but you want to push me into retirement.
Sir, looking at your bungalow in Alibag, I think it's time you took a break. Yeah. we can all see it behind you, but anyway, that's fine.
So basically, yes. So there is a lot of confusion as to why varicose veins occur, and rightly said that it has to be weak valves. Yeah. Really, there is no way of actually strengthening your valves. If your valves are weak, then they are going to be weak. What you can do is you can ensure that the blood which is there in your legs is reaching your heart adequately. In order for you to do that, the muscles of your calves should work regularly. That's the reason for walking regularly, for when you're sitting continuously to move your legs up and down, and when you're standing continuously, do something called toe exercise. Stand on your toes up and down, over a period of time. This is the way you can really strengthen your muscles and help the return of blood back to the heart. Another very important thing I must stress nowadays, because people are using the gyms. If you have varicose veins, please do not do weight lifting in an upright position, or you do leg crunching. When you do that, you're putting a lot of pressure on your groin and the veins. And the valves which are weak will actually start leaking, or if they are leaking, they will start leaking more. If you have to do any form of weightlifting, sleep on a bench and do weights after that. So you're in a lying down position when you're doing weights. Okay? Because a lot of these physical instructors come to me for this. A lot of physical instructors actually themselves have varicose veins. So I instruct them, please lie on a bench and then do weights. And especially don't do leg crunches if you have varicose veins. Your varicose veins will get worse.
There are a lot of questions on the chat box. I'll take them one by one. First is from Sneha Patak. If there is just some pigmentation or spider vein, should one still see a doctor?
So it depends where the pigmentation is from. If the pigmentation is around your ankle, that means the pressure is coming right from the groin or from the knee joint. And that is definitely a matter of concern. If there are only spider veins in the thighs or the legs or the calves, then that, if there are no symptoms at all, it's a cosmetic issue. And then if you really want to get cosmetics done, then we do it a little differently. I didn't show that today, how I do that. That's a different procedure, but then that's a cosmetic issue.
And Rajesh Bajaj is asking, should we put our leg a little raised at night every day? I guess she means put a pillow under our legs.
Yes. So if you are going to be using stockings, then you're compressing your veins anyway throughout the day. You don't really need to do that. If you're not using stockings, then you need to basically get that bad blood back from the legs to the heart. Then elevating the legs will make sense. But to be very honest with you, elevating the legs is disturbing. It's very uncomfortable. People really don't like it.
And Elena Mirza is asking, what is the dosage of Dalton and for how long?
So it's actually Daflon. It's not Dalton. It's DAFLON.
Okay.
And the dose is 1000 milligrams, 1 tablet a day, and to be taken after dinner. And I must tell you one side effect of Daflon, it occurs in 1% of people. It can cause stomach bloating in about 1% of people. So try Daflon. It really doesn't cause any other harm except for bloating. If it causes bloating, then obviously you don't need to take that. The other alternative to that is a tablet called horse chestnut capsule. There's a tree called a horse chestnut tree. And from the extract of the horse chestnut tree, you get a tablet called a horse chestnut extract capsule. You can take it twice a day. And if you have symptoms of irritation or burning of spider veins, it helps to relieve those symptoms. Yes.
And Ranu's iPhone is asking, keeping feet and leg above against the wall, does it help?
These are all sorts of exercises which are used to basically strengthen your calf muscles. If you do tiptoe exercises also, they are good enough.
Okay. And Snigdha is asking, removing or closing superficial veins, does this mean that these veins have no function and there is no disadvantage in removing them?
Right. So nothing in the body has no function. These veins basically had a function of taking the blood back towards the heart. When it's varicose veins, they are actually bringing the extra bad blood down towards the legs. And by doing that, that bad blood finally has to go back up towards the heart. So how does it do that? It goes back through the deep veins. So over a period of time, you're overloading the deep veins. So you're going to create a problem for the deep veins in the future. That's the reason you need to close these veins. Having said that, does removing these veins cause a problem? Not at all. What do you do in bypass surgery? You use the same veins in the heart. Understand? Because as I said in my first slide, 90% of the blood of the legs goes back through the deep veins. Only 10% goes back through the superficial or the skin veins. And the capacity of the deep veins is 3 times more. So even if 3 times more load is put on the deep veins, it can take it back. So even if you close all the skin veins at one shot, there is no problem to the leg at all.
And Kriti Sabu wants to know, what is the name of the stockings to be used?
Right. So these are called compression stockings. And they are basically what you need is class 2 stockings. They're called class 2 stockings. There are many companies. One is a Swiss company called Sigvaris. There is a German company called Medi. There's an Italian company called Viola. So there are many companies which give these stockings, but make sure they are class 2 stockings, not the regular stockings which you get from the chemist.
And Sheetal Daria wants to know, can it reoccur after treatment at the same place?
Right. So first of all, let me tell you that there are many skin veins in the legs. There are about 10 to 12 major skin veins in each leg, and there are about 150 valves in each leg. Now, depending on how many valves are weak, you will develop varicose veins in those veins. Furthermore, all these valves may not start leaking at the same time. Some valves will leak now, and you'll get varicose veins in those veins. Some valves will leak 4 or 5 years later. So it all depends on a period of time. But overall, if you see, amongst treated patients, the chance of recurrence of varicose veins is around 6 to 7%. Yes.
That's very low. I mean, worth taking the risk. Yeah. And Suryakant from Thane wants to know, how good is a brand called Visco who makes varicose veins stockings?
Right. So Visco all these years used to make stockings which we should throw in the dustbin. They're very thick stockings, and they used to cause a lot of complications because they're not suited for Indian conditions. Currently, they have come out now with cotton stockings class 2, which delivers the same 23 millimeters of mercury. So if you're going for Visco, make sure they are pure cotton class 2. But they are a little difficult to source as of now.
Excellent. Doctor, this was an excellent presentation. You can see the number of compliments you've received on the chat box.
Thank you.
And some of them would like to know if they need to contact you, how do they get across to you?
All right. So I'm basically at Doctor House on Pedder Road.
Okay.
And if anybody wants a number, it's 2352-5001.
Okay. So you can just WhatsApp it to Netra later and then
I'll
she'll
do
share it with the whole group. Yeah.
I'll do it.
Thank you, Dr.
Thank you.
SHOAIB PADARIA. This was an absolutely fantastic presentation and crisp and clear. Very, very rare in today's date, and you've done a great job.
Thank you.
So I'd request Club President Nimesh Sangrajka to propose a formal vote of thanks. Over to you, Nimesh.
Yeah, thank you, Mehul. Thank you, Shoaib, for a wonderful lecture today, which it was quite informative. I'll just share a screen right now. This is a certification of appreciation. This is presented to Dr. SHOAIB PADARIA for participating as a speaker at our club on 20th May 2021.
Thank you,
Thank you,
Dinesh.
Thank you, Dr. Padar, for explaining us the cause and remedy for the varicose veins. Your presentations made it so easy for us to understand the disease. Thank you for coming and enlightening our club members on the topic of varicose veins. And before we part, I just wanted to felicitate Rotarian Sabina Gupta for her stupendous leadership as a president for Smart Year 2021. We could not do the felicitations during the lockdown. We have a tradition to thank our outgoing presidents with a vote of thanks, and this is one quite late but not forgotten. Well, we have wonderful last year when Sabina Gupta was the president of our club, 2019-20. We had good projects, outdoor picnics, overseas trips, Statue of Liberty, Old Bombay Darshan, and many more fellowships which we really missed this year. She took the club to another level with 3 global grants done in her year, and we were the 3rd highest contributor to the TRF of the district. We got platinum citations from RI and districts. Even during the last 3 months of COVID, we did so much work for distribution of food grains, to PPE kits, to masks, to various hospitals. We cannot forget that year at all. We cherished every moment of this year. I call upon Yashwant Date to speak for 2 minutes for Sabina Gupta. Yashwant, are you here?
Yes. Am I audible?
Yes.
Good evening, friends. And where is my friend Sabina? I don't see her. Is she around?
Yeah, she is here.
Okay, guys. Nimesh has said enough for what Sabina's year was, and after March last year, the COVID came in, and after that we are having these Zoom meetings. So we are kind of getting very comfortable with the Zoom meetings, and many of us want to meet in. So as all of you know, and if you all will unmute yourself for a minute, I want you to clap for Sabina's wonderful year, and you know the lady with lovely cake.
Sabina, congratulations.
Thank you, everybody.
Congratulations.
Congratulations.
Well done, Sabina.
Congratulations, Sabina.
Great,
Thank
Sabina. Great year.
Super job.
Sabina, great year you had.
Super year.
Thank you.
So Sabina, you know, all of us, we love you so much that we want you to come back as a president again.
Oh my
So
God.
that,
3 cheers for Sabina.
okay, hip, hip.
Hooray.
Hooray, hooray.
Hip, hip, hooray.
So back to you, Nimesh.
Yeah, so I'll just play a small video which we have given a small token of appreciation from the club. So we can just have a look at it.
And the flowers to top it. Awesome.
Open the big one first. Don't chicka actually.
Yeah, you want this scissors? This itself is so pretty. What lies inside? Two of them are there. One will fall down. They're not stuck. Sorry. Wow, very pretty.
ये जोड़ी है.
Very nice.
While we all clap for Sabina, I would also say that we need to clap for Pankaj for being such a lovely husband and supportive husband.
Yes.
Of course.
Who did the clapping? Tell me.
Yeah, big support to her.
Compared to you. Very nice. I love
वो दारू का bottle नहीं है भाई.
black, white and red.
Hey, cheers, Pankaj.
पाएगा ना वॉक करते करते पीने का बॉटल नहीं है.
Where is Pankaj?
You know, I think ये भी मैं ही use करूँगी ज़्यादा.
There he is. There he is.
पंकज की जय हो.
Pankaj bhai ki jai ho.
Congratulations.
The way you have packed the other one.
Sabina, congratulations.
Thank you. Thank you so much. Love you all.
This is so pretty.
Hats off, Sabina. Hats off.
So this was a small presentation we had for Sabina, and hope we again get you back as a president, maybe after 2 years. Okay, over to you, Sachin. Over to you, Sabina, for a small whatever you want to say to the club.
Thank you, Nimish. Thank you, Yashwantji, for the very, very kind words. I thoroughly enjoyed the smart year, though a little scared in the beginning, but then got the confidence and I did my best. Could have done better, but I tried my level best. And it all happened. We were the best because of all the support I got from you all. Love you all loads. Love you all, guys. Thank you so much.
Love you too. Love you too, Sabina. Pankaj.
Yeah, Pankaj is right here. And of
Pankaj
course,
is
lot
a backbone.
Pankaj was a big sport. Pankaj was a big sport. And Sabina was there whenever we wanted her. So thank you, Sabina, for that.
Pankaj and Sabina, God bless you for being such an awesome couple and leading the club.
Thank you.
We really had a great
The
time.
best cakes what we had all these years. The best cakes
Yeah, exactly. That's true.
at all the fellowships. It was great.
Sabina Gupta, congratulations.
Thank you.
Pankaj, hats off.
Sabina,
Cake
we are
wala
big
ye tha.
cake and dessert.
Congrats, Sabina, and first gentleman Pankaj.
Thank you. Thank you.
And also for
Visalma.
organizing one of the best meetings with that Boman Irani. One of the
Yeah.
finest meetings in our history of our club, I think.
Yes, I really loved his meetings. He was so
Pankaj,
good.
whistle mar. Pankaj, whistle.
छूट गया है, उसका गार्डन जाने का बंद है.
अरे बिल्किस, पेट्रोल का भाव क्या हो गया?
अरे बाबा, डोंट क्या हो गया? सब लोग पढ़ रहे हैं ना.
बढ़ा के रख दिया, 100 रुपए के पास पहुंचा दिया. कुछ जरा सोच समझ के कर.
रोटेरियंस के लिए 20% डिस्काउंट है.
No, अरे ऐसा हो तो बाप रे.
बिल्किस के
वाले को डिस्काउंट दे ना, हम लोग सब लोग आते हैं भरने के लिए.
डिस्काउंट मुझे मिलेगा तो तुम लोग को ही दे दूंगी बस. Don't worry.
Nimesh,
Yes.
Dr. Shoaib is waiting. You can officially close
Yeah.
the meeting.
No, one sec. I'll just call Sachin for. Sorry,
Yeah.
Doctor. Sachin, can you give the secretarial announcements, please?
Thank you, Nimesh.
Yeah.
Secretarial announcement. So birthdays we had on May 9th, Rotarian Rakesh Jain celebrated his birthday. On May 10th, Rotarian Prabhakar Nakashe. anniversaries. On 8th May, we had Rotarian Dr. Kamlesh Sarita Khandelwal celebrated their anniversary. 16th of May, Kavita and Sashi Chopra celebrated their anniversary. And today we have Amit and Rajeshwari Bhalotia as anniversary. Our next meeting is Coffee with the Doc series on May 23rd, Sunday, 8 a.m. in the morning, wherein Dr. Milind Navlake will be talking on black fungus, which is the hot topic for the current period. And on 27th May regular meeting, we have Mr. Varun Tanna, son of our own Pankaj and Meena Tanna, who will be talking on marketing. As regards attendance, we have 100 members present today, 100 total attendance, of which 26 members and 13 ANs and 61 guests. So I think I've seen 100 for the first time today in regular meetings.
It's a good.
So that's the basically thanks to Dr. SHOAIB PADARIA for this encouraging attendance, wherein members are eager to listen to you. Thank you. Over to you, Nimesh.
Yeah, thank you, Sachin. I'll just adjourn the meeting here, and we can still continue talking about Sabina.
Okay.
May I just thank everybody for
Yeah.
inviting me. It
Thank
was
you,
indeed a pleasure and a
Yeah.
privilege to be addressing the Rotary Club of Worli. And I am really thankful that all of you enjoyed my lecture. And I just hope that I've been able to convey some sort of medical information which might be of use to you, your colleagues, your family members, or whoever. And please pass on this information to you. Thank you once again for inviting me. And if you permit me, I'll take your leave.
Thank you very much.
Thank you.
Thank you. Very good lecture. Very good one.
Nimish, that
Yes.
Paula's meeting is there now.
Yeah, after now it starts. You can have that
8
connection.
o'clock.
I already sent the connection. Yeah.
Yeah, 8 o'clock.
Yeah. So whoever wants to join, I already sent it on the project groups. Paula's lecture is there now.
Thank you, Sabina.
Sabina, thank you.
You are muted, Sabina. You are muted.
Sabina, thank you very much. Great year, great year.
Thank you all. It was because of
Sabina, you
everybody.
gave us great comfort. The visit to Statue of Unity was one of the great memorable things. It was there.
Yes.
Nimish, are you continuing with the same meeting with Paula?
No, she has a separate
Or
meeting.
you
You
have
have to register and go there.
separate meeting.
Yeah,
Okay.
separate meeting.
All right.
She has it from her own side. She's been
How do
invited
I
somewhere.
connect? How do I connect, Nimish? How do I connect?
On the link you have to go. You'll have to email them. They'll send you a password.
Then I've done it.
Then you just connect they'll send an email where you just connect the link.
Acha.
Yeah, that's
Okay,
it.
bye.
Yeah.
Thank you. Bye,
Thank
bye,
you. Bye.
everybody.
Bye.
Thank you. Bye.
Bye.
Good
Bye.
night.
Bye.
Bye. Good night.
See you. Good night.
Good night.
Good night, everyone.
Good night.